Hello to everyone. Now in this video we'll be seeing the chronic lymphocytic leukemia. So leukemia is actually the type of blood cancer actually. Okay, so it is in the blood. So it is chronic type from long duration and it is in the cells of lymphocyte, and leukemia is actually in the blood cells. Okay, decrease in numbers of leukocytes in the blood, that is called as leukemia. So it is characterized by aggressive accumulation of phenotypically mature malignant B lymphocytes. So when the B lymphocytes are increased, malignant B lymphocytes, malignant meaning cancer. So cancerous B lymphocytes accumulates, then it leads to chronic lymphocytic leukemia. Now primary sites of disease include our bone marrow, basically spleen and lymph nodes. So these organs are affected. Symptoms: lymphadenopathy, splenomegaly, increase in size of spleen, liver, hepatomegaly, fatigue. Patient will come with fatigue, fever, weight loss and rapid satiety, hunger. Now, what are the general information we should know about leukemia is that most common type of leukemia in the territories of America. It is in America, this is the most common type, and average age of patient with CLL is around 70 years. Okay, so patient with CLL actually develops at the age of 70 years, but it is very rare in the children's population. Average risk of developing CLL for both sexes is around 0.57%. Okay, now causes of the chronic lymphocytic leukemia is unknown basically most of the time, but most common among is in the Jews from the Eastern Europe. We see in the peoples of Jews from the Eastern Europe most commonly. Now, what is the pathophysio of CLL? So first what happens is lymphocyte first accumulate in the bone marrow, then spread to the lymphocytic neutrophils and other lymphoid tissues. Okay, and eventually cause splenomegaly because they accumulate in the bone marrow also enlarges, and it, as a compensatory mechanism, spleens enlarge because due to the more production. Okay, as well as systemic manifestations such as fatigue and fever occurs. As CLL progresses, abnormal hematopoiesis leads to anemia and neutropenia and thrombocytopenia. So all the cells number decreases. Okay, in the patient with chronic lymphocytic leukemia. So what are the patient come with leukemia? You can see the symptoms here. Okay, so first is the fever, swollen lymph nodes, lymphadenopathy, bleeding will be very easily, bone pain, night sweats, red spots, nose bleeds, okay, and severe infections and weight loss. So these are the signs you will see with the patient come with leukemia. Clear? Now, what are the symptoms? Basic symptoms, as I told you, these were the symptoms, but we'll just discuss. Weakness, enlarged lymph node, as I told you, heaviness in the abdomen, very prone to infections because cells are decreased, like neutropenia is there, thrombocytopenia, leukemia. So all these cells actually fight from infection. So if they are decreased, then they are very high risk of developing infection. And we have weight loss. Clear? Now, first symptom of chronic lymphocytic leukemia is increase in size of lymph nodes. So lymphadenopathy is the first sign of the chronic lymphocytic leukemia. In 25% of cases, disease is detected accidentally during the blood test. So we don't have any symptoms or sign to develop, but if we do a blood test, then we unknowingly we in the 25% of cases accidentally we develop this disease. Okay, so now what are the diagnoses we will do for the patient? And general blood tests, we actually do the most common, most preferable diagnosis, and peripheral blood smear, peripheral blood flow cytometry we will do, immunophenotyping we will do. CLL can be detected or suspected for the first time with absolute lymphocytosis in blood more than 5000 ml per liter. Okay, so this is the first sign you will see, lymphocytosis. And circulating lymphocytes will express CD5, CD19, CD23 kappa in light chains. This should be expressed by the lymphocytes. And patient with absolute lymphocytes less than 500 milliliter are diagnosed with monoclonal B cell lymphocytosis. 1 to 2% progress to the B cell lymphocytosis, and during the examination, hypogammaglobulinemia in less than 15% of cases we see an increase in LDH, okay, lactate dehydrogenase enzyme, uric acid and calcium, hypercalcemia. So these we see in the serum blood test. Okay, and this patient comes with this presentation. You can see lymphocytosis asymptomatic, first sign as I told you, and generalized lymphadenopathy. These are the increase in size of the limbs. So lymphadenopathy and hepatosplenomegaly. So these are the liver will be enlarged and here spleen will be enlarged. So these two organs are involved basically in the clinical presentation of chronic lymphocytic leukemia. Now, what are the stages of chronic lymphocytic leukemia? We have 3 stages: stage A, stage B and stage C. Lymphocytosis, lesion of no more than 2 groups of lymph nodes are actually stage 1, but means the group of lymph nodes are not more than 2. Okay, and we don't see thrombocytopenia and anemia, then we say it as a stage A. Stage B is 3 or more lymph nodes are involved but no thrombocytopenia and anemia. Stage B. Stage C is a presence of thrombocytopenia and anemia are present in this case regardless of number of affected lymph nodes. If we have one only and we have thrombocytopenia anemia, then it's case of stage 3. Okay, depending on the presence of certain symptoms, we divide our stages. Is first is presence of lymphadenopathy, stage 1, with enlarged spleen, stage 2, with presence of anemia, it is stage 3 according to symptoms. Clear? So this is the chronic lymphocytic leukemia. And what are the treatments we do? We used to give chemotherapy with chlorobutine. Was until recently the standard method of treatment for chronic lymphocytic leukemia. Chemotherapy with drug chlorobutine. This was the drug of treatment for this. And we also used to give bioimmunotherapy using monoclonal antibodies, high dose of chemotherapy with hematopoietic stem cell transplantation. And to kill the blood cells, cancerous blood cells, we used to give radiation therapy. And in the case of splenomegaly, we used to do splenectomy or removal of spleen. So these are the guidelines for the treatment of the chronic lymphocytic leukemia. Thank you.